Now, it is painful to see COVID cases numbers rising. Once again, this started around Thanksgiving, and cases are now very high, higher than they have ever been, in fact. I'd like you all to pay attention to this first slide. I want everyone to understand that today's situation is very different from a year ago. Case numbers are high, yes, and that's a reason for concern, but not a reason for panic. And let's talk about why. For these 22 months, we've all focused on the number of cases. It has been one of the defining data points that we've used. But now we need to look at cases numbers differently. That's because of the vaccines. A year ago, vaccines had just become available. Almost no one had gotten a shot. Today, more than 14 million shots have been given in Virginia. Close to 90% of the adult population has had at least one dose. Only 9 states have given more shots, and they are all larger states than Virginia. That's good news, and it's thanks to a lot of hard-working Virginians. And this is important. Vaccinations are keeping people safer, even as the Omicron variant spreads. Yes, vaccinated people can get COVID. That has always been true, and it seems more true for the Omicron variant. But data from around the world for nearly a year now shows that if someone is vaccinated and they get COVID, the symptoms are likely to be minor. Fewer vaccinated people have to be hospitalized with COVID, and far fewer of them die of COVID. That is how vaccines are designed to work. And that is why we need to shift our thinking and study not only the number of cases, but also how severe those cases are. Not just the number of people who get COVID, but also the number of people who are hospitalized because of it. Fortunately, the Omicron variant appears to cause symptoms that are less serious than previous variants, especially for people who are vaccinated. And the data are clear. Nearly everyone going to the hospital with COVID is unvaccinated. Here's an example from Southwest Virginia. 91% of their COVID cases are unvaccinated, including 97% of those on a ventilator. We'll repeat that. 97% of individuals that end up in the ICU on a ventilator are unvaccinated. Vaccines work, plain and simple. That's why we have been saying for a year now, to protect yourself, to stay out of the hospital, please get vaccinated. We also have to acknowledge that while the Omicron variant seems to cause less serious symptoms, especially in the unvaccinated, it's also highly contagious. That means that even though the symptoms are less severe, if more people get sick, more people are going to need to go to the hospital. And that is what we're now seeing around the country, and especially right here in Virginia. It's causing a real strain on the people who work in hospitals. Doctors and nurses have worked tirelessly for 22 months to care for people who have gotten sick. I say tirelessly, but it's not really the right word, because they are tired, they're exhausted, and they're burned out. That's why it's so important for all of us to help them. So please go to the hospital only if you believe you really need to. Let's not put even more pressure on hospital workers to care for people who don't need to be there when they're seeing rising numbers of people who do need to be there. That's why we're taking action today to help our hospitals. So why now? Because last week, the daily census numbers in hospitals around the state hit record highs. That breaks a record set 1 year ago in January of 2021, when vaccinations were just starting. And you can see the hospitalizations going up. This chart shows the peaks from December of 2020 through Delta to now. I watch the numbers every day, and I'm in close contact with our health systems. They need our help. So today, I am declaring a state of emergency in order to ease the pressure on Virginia's hospitals and their staff. This order will help in several ways, primarily by allowing hospitals to expand bed capacity and giving more flexibility in staffing. It also allows more use of telehealth, and it expands which medical professionals can give vaccines. This isn't restrictive in any way. Instead, it relaxes some regulations to help get to help get care to the people more quickly. As I noted a moment ago, even though the Omicron variant symptoms are typically less severe, with more people getting the virus, more people need to go to the hospital. Hospitals are feeling the strain. In Northern Virginia last week, Inova said that they admitted 94 patients with COVID. That's up nearly 10 times. Last year, between April and Christmas Day, their average was fewer than 10 per day. In Hampton Roads, Centera said they saw a 300% increase in COVID cases in just 10 days. I want everyone to know that we don't expect this to continue indefinitely. In fact, modeling from UVA's Biocomplexity Institute suggests that we'll see this wave of hospitalizations peak in early February. That is why this emergency order will last for 30 days. I know you're all asking, what can I do? For now, we all need to keep doing the same things we have talked about over these past 2 years. Wear a mask around others, especially if you don't know if they're vaccinated. Get a booster shot. Shots are widely available at pharmacies, at doctors' offices, and local health departments across Virginia. Now's the time to get your children aged 5 and up vaccinated. This will make it easier and safer for them to be in school. If you continue to choose not to get a shot, you need to wear a mask and practice social distancing to protect yourself and to protect those around you.